Hi everyone, we are here today at OrthoCarolina Concord's physical therapy office, and this is Scott Beecher, the PT manager. Thanks for being here with us today, Scott.
You're welcome.
Can you tell us a little bit about your role here at OC Concord?
Yes, I am the manager, and we have 5 PTs here. We have 3 PT assistants, and we have 1 occupational therapist, and I get to oversee all those people, and I think we have the best staff over here.
Sure, and what kind of, and here's some of the staff members. Say hi, everyone.
Hi.
And what kind of conditions do you treat here?
We see everything from the spine to extremities. We see non-operative, we see operative issues. So we do hands. Rob does hands, or sitting over here at this table. And so we have, in our clinic, we have 2 sports medicine doctors. We have a hand specialist. We have a spine specialist that comes here once a week. We have a total joint specialist that does revisions. We also have a foot and ankle surgeon, and that's kind of what we're discussing today a little bit. Is we get a number of referrals for plantar fasciitis, and so it's a condition that about 10% of the population gets it, and we tend to see it in men and women. We tend to see it a little bit more in people that wear poor shoes, people that have jobs where they have to stand on their feet for prolonged periods of time. Some people are training in improper shoes, like running and going up and down hills, and those are some of the things that can bring on plantar fasciitis. So I have a little model here. If you look here, this is the bottom of the foot, and you can see that there's a long band of tissue that goes from the back of your heel up to your toes there, and this red area there is where a lot of people get inflammation. So when we talk about plantar fasciitis, it's sort of an inflammation and a micro tearing of that tissue down in this area. And so sometimes when people have tightness in their calf muscle, or if they wear poor shoes or have poor arch supports in there, sometimes this is stressed too much and it creates some micro tearing in this area. And so people describe it first thing in the morning. They'll get out of bed and they'll say, boy, I feel like I'm walking on a bruise, a stone bruise in the morning. And so these are all things that we try to treat. Most of the time the doctors will start people off with an anti-inflammatory, and they may prescribe some stretching exercises. They'll show them that themselves at home. And so some of the stretches that people will do with it at home would be like a calf stretch. They would come back like this. They would stretch their calf a little bit. Sometimes just putting your foot up on your bed and grabbing your big toe and pulling back and hold it there for 30 seconds to a minute, and do that several times a day is another good little self-stretch that you can do to help with that at home. And so but when it comes to therapy, if those things aren't working, then usually the doctor will refer them in for physical therapy. And so I thought what we do is we touch upon just a few of the things that we do with them in therapy here, and we'll show you a few of those. So we'll start, if you don't mind, let's turn that way.
Sure.
And look over here, and this is a taping technique that we found very successful with treating plantar fasciitis. And Teresa here is going to tape Jacob, and this is to help support the arch. And this is a treatment that a lot of patients can do to themselves. They can get their own tape and tape themselves. And usually the tape, if it's done properly, the tape will last for 2 or 3 days, and you can shower in the tape. And so she's pulling that up nice and tight to support the arch.
So it's kind of just like forming an active stretch constantly?
Yeah, it's a stretchable tape, but the benefits of the tape itself are to support the arch, but also increase some circulation down in there. It works on the fascia around that area and sort of lifts the fascia up and hopefully improves a little circulation around the plantar fascia. So that's
interesting.
That's another way to treat that. All right, and then Jacob, if you guys don't mind switching, and Jacob will show you a little technique that we do. And this is instrument-assisted soft tissue mobilization. which we go in and we will actually try to improve the extensibility or the flexibility of the tissue down in there, but also increase circulation, decrease pain, and we will run it all the way up into their calf region and treat that for a few minutes. So that's called instrument-assisted soft tissue mobilization.
It's got to be a tolerable pressure.
Yep, and you don't want to push it
So
so hard that the patient can't relax.
Right, so it's not painful.
Although some people do have very sensitive plantar fascia, and you really have to just make sure that you are not putting too much pressure, or they won't come back.
Right.
So,
And you can do that by changing the angle of the instrument. If you have more of a flat angle, it's going to have less pressure than if you have a more perpendicular angle there.
Okay.
so that's a...
We didn't hear her, she just said it tickles.
Alrighty. And then over here is something new that we've been doing recently, and this is called dry needling. And both these two therapists, they are certified in dry needling. And so we have used this technique to help with people with chronic plantar fasciitis, and we find it to be also very effective.
So the needles are placed in specific areas, either around the joint or around certain muscle groups or like ligaments. Sometimes it's dependent on where they're having tenderness. You can also do it there. But this is to help decrease inflammation, help with pain, help with some circulation. So I'm just going to kind of show you a couple of points here.
Sure.
My friend Heather. It's not always anybody's favorite. A lot of times people will have either weakness in their pushing off with their first toe, which Scott started talking about.
Okay.
So this is kind of part of that muscle group there. Going for the middle of the heel. Sometimes what I do also, after I've done it for a while, because people have a tendency to kick back, you can kind of hold them in a position so they're not doing that. One of the places that most people have definitely point tenderness at, and they can say it's exactly right there, is this last point is along right where your calcaneus comes around, right on the inside right there. Most people say that it hurts right there, right on that tubercle.
Right.
So when we place these in here, we can twist them, which usually I do that right at the end. But you can also right here, because it's close to the heel and the attachments for the fascia are right around there, you can actually peck the bone a little bit, called periosteopecking, to increase the circulation.
Okay.
So we can get some healing in the bottom of that heel. But yeah, typically you're gonna set these, let them go, let them relax, twist them every 5 minutes or so, and that actually helps some of that tissue wind around the needle so that it starts to heal a little bit better.
And dry needling is suggested for more chronic plantar fasciitis?
It really doesn't matter. It's for acute, chronic. The sooner you can get this to calm down, the better off you are.
Right.
And not letting it go to a chronic state. A lot of times we would prefer to just have people when it first starts happening.
Right, that makes sense.
Yeah, yeah. So, and she can sit here for about 15 minutes or so, and take them out. So,
Great.
Okay. So that's a few of the techniques that we do. The other thing that we do sometimes with people is we look at their foot alignment, and if their foot alignment's off, if they have like a pes cavus foot or a pes planus foot, which means you either have a high arch or you have a low arch on your foot or a very loose arch, and sometimes by putting orthotics in there, it seems to help. And we do some custom orthotics at our facility here. If you look over there, you can see we have a standing platform that will heat up the orthotics, and all three of us make the orthotics here, and so we tend to do that. But also we have a newer orthotic that Sarah Reed with OrthoCarolina has started to do. She puts a platform on the ground, and you walk over this platform, and it gives you a readout in the computer, and they send that readout off to a laboratory, and they actually do a 3D printing of the orthotic.
That's
which
awesome.
comes back, and so it does a pretty good job as far as I'm concerned. I had her make me a pair of them, and I think they're very comfortable.
And it works for you?
Yeah, it works for me. It works for me. But we also do these, and Dr. Erden does does prescribe orthotics quite a bit on patients that do have foot pain, and so it works out well. So in a nutshell, that's a little bit what we do for plantar fasciitis. So hopefully that'll be helpful
Yes.
with some of the people that are watching this. And
Yeah, and if our viewers have any more questions, head to OrthoCarolina.com and be sure to submit any questions or call OrthoCarolina Concord for help. Thank you again, Scott, and thank you to the rest of the staff here today for helping us solve the plantar fasciitis mystery.
you're welcome. Thank you.